Hello friends, I am Dr. Rohit Maidur, medical gastroenterologist and hepatologist working at Medicover Hospitals, Whitefield, Bangalore. April 19th every year is celebrated as World Liver Day. The importance of this day is to create awareness among people about liver health. What are the diseases of liver, how to prevent them, what precautions to take, and how to get cured of liver illness. The theme of this day is decided every year. This year theme is Food is Medicine. The theme highlights that we are what we eat. The amount of food, the type of food we consume, and the time of day that we consume food decides the liver health. Not only liver, in general, the human health is partly decided by the food. Apart from food, the physical activity and lifestyle also matters. The liver health is usually dependent on the routine. If a routine is not there, the liver health is affected. The common causes for liver disease like hepatitis, that is inflammation of the liver, includes viral infections like hepatitis A to E, and in recent days the excess alcohol consumption of alcohol starting at a younger age, apart from having junk foods, overeating, more of sweeteners or sugary food, deep fried food. This is part of the spectrum of diseases which we see in liver conditions. The contributory factor to liver disease are presence of diabetes, hypertension, associated dyslipidemia as in high triglyceride or abnormal cholesterol levels. Apart from that, obesity, that is overweight, and reduced physical activity. These are the causes that can lead to health issue in liver, which is called as metabolic dysfunction associated liver disease, that was previously called as non-alcoholic liver disease. Most of the people who come to us with fatty liver, which has become more common in nowadays, they just go to a routine health check and they find out they have fatty liver. Subsequently, on evaluating, we get to know either one of these conditions has contributed to the liver health. Now, fatty liver per se is not a significant disease. It's an alarming feature, or it's a alarming sign that you have to change your lifestyle. So the importance of knowing adequate precautions to prevent liver disease is you can prevent the progression of fatty liver to cirrhosis, taking enough precautions by being physically active and maintaining the proper diet pattern. Apart from the infections, alcohol, and this spectrum of diseases, to some extent the presence of thyroid disease and other metabolic dysfunctions can also lead to liver health problem. Now, the reason to highlight this liver day is to get proper cure, and when presence of symptoms like loss of appetite, fatigue, or jaundice, or in extreme cases somebody has leg swelling and abdominal distension, where we call it as decompensated liver cirrhosis, you need to seek medical attention. And when we see people with liver disease, most of the times it is after history and clinical examination, basic blood test and ultrasound scan. In some cases, maybe additional test including endoscopy is required. Since liver is part of the digestion system, the digestion system will be affected in people with liver disease. So it becomes our responsibility to educate and further help them overcome these ailments. For further information, or if you know somebody who has liver disease, you can visit Medicover Hospitals, Whitefield, Bangalore. Thank you.